But I want to bring in someone who knows a lot about this case. Dr. Jonathan Groner is a professor emeritus of surgery at the Ohio State University College of Medicine. He's been studying executions extensively, traveling to death row in multiple states and examining inmates whose executions were botched. Doctor, it's really good to have you. Jesse Hoffman is arguing that nitrogen hypoxia is going to interfere with his Buddhist breathing, make him claustrophobic, and worsen his PTSD. Can you explain to me exactly what happens when you're dying under the method of nitrogen hypoxia?
Well, nitrogen's not a poisonous gas. It's an inert gas. You're breathing it right now, so am I, about 78%. So the mask gives you 100% nitrogen, so you don't get any oxygen. I mean, I can't comment on the Buddhism and the PTSD, but I can comment on is that as long as you hold your breath, you won't die. So some of the other people have tried to hold breath holding for extremely long time, which is extremely painful. And then sudden fall in oxygen causes a seizure. And when people have witnessed these executions and seen people shaking violently, I suspect they were having grand mal seizures. So it's a pretty ugly way to die. I can't tell exactly what the person's experiencing. I don't think it's good. It does take some time. The firing squad, which I think is what he preferred, would be a lot quicker. We had an experience that last week where a doctor examined someone, I think within 3 minutes of the execution, and found that the person was dead.
I mean, from all, indications and experts, it seems that the firing squad, as macabre as it seems, is the least painful or lengthy way to die. With nitrogen hypoxia, how long can it take, does it take, and have you seen it before, and is it often botched?
So first of all, I don't call it hypoxia, I call it nitrogen suffocation. Hypoxia is a low oxygen level, and a lot of people actually live that way due to heart problems or lung problems, but it is a suffocation. So it's a little bit more like waterboarding. Whereas like the firing squad is obviously very fast. I doubt someone actually feels a lot during a firing squad. By the time they recognize that they've been shot, they probably are already unconscious. So, and I've seen when people hold their breath for a long time, they get something called pulmonary edema. I've seen that in patients, and that's a terrible thing to see, very frightening, and also quite ugly. So, I mean, the question to me is like, why nitrogen when there are other ways that are more obviously available?
I was more curious about how long it takes.
Oh, I could just say several minutes. Lethal injections have sometimes taken up to 2 hours because they can't get the IVs in. That's not happening with nitrogen. I think, maybe 10 minutes. I'm not sure. I had not witnessed one, but it's sort of in the medium range. Firing squad is seconds, lethal injection can be hours. Nitrogen appears to be somewhere in the middle. But obviously they don't go quietly, I will say that.
The whole thing is just so gross, if you think about it. But I think a lot of people also say it was more than a couple minutes that that poor young victim of his was terrified for her life, and eventually she had good reason to be terrified because she lost her life. Dr. Groner, thank you so much for your expertise. I do appreciate this.
Thanks for having me on your show.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.